I've been in practice 38 years, and while I have multiple degrees, I've attended medical school, naturopathic medical college, and chiropractic college. I also have board certifications in orthopedics, in acupuncture, and I limit my practice to integrative medicine. But then when I look at the benefits versus the risk of anything that a patient takes, that has to include radiation, surgery, chemotherapy, GcMAF, or high-dose vitamin C as a therapy, I have to look at the potential benefit as well as the risks that occurs. I have seen very little or almost no side effects reported from my patients who are personally using the GcMAF on their own. When we look at chronic metabolic diseases like cancer, one of the things that really surprised me is the great number of differentiated or different types of cancers that it seems to work on. Now, I've read the studies and I've seen the studies, but when you actually see these cases come into your clinic and you see these patients choose to use GcMAF and actually see the results, it's quite impressive. I've seen excellent results with people in stage 3 and stage 4, which is greatly surprising and rewarding as a practitioner. I've seen it work on stage 4 prostate cancer in a particular individual who was seen for many years, close to 10 years, at a major teaching hospital here in the United States, and they gave up on this individual and told him they can try some additional chemo if he wanted, but basically had come to the conclusion that he needs to go home and make do with what had been done. This man came to me, his nagalase was elevated, his natural killer cells were poor, everything about his testing showed that this man, like they suggested, was not going to do well. And he used the GcMAF at the dosages that are recommended. His most recent laboratory testing in only a few months showed that his nagalase was within normal limits. His other laboratories, particularly his chemistry, is 100% normal at this time. And now this man plays golf, plays tennis, travels around with the world with his family, and does things that a normal person wouldn't even have the opportunity to enjoy. But I've had cases, and particularly one that made me really think well of GcMAF, where this individual had a high nagalase, a poor natural killer cell, a very high C-reactive protein, and very poor cancer markers, and in a matter of a number of months, his numbers dramatically improved. And one day the man called me and said, "Dr. Cohn, I'm concerned about something." He goes, "I haven't been bleeding for a number of weeks or actually months since I started the therapy at your clinic and using GcMAF. And all of a sudden, I looked down in the toilet and there was some blood in the toilet." He asked me what to do, and I said, "Well, you really should do what any other patient would do, and that's to pick up that material, put it in a specimen container, and take it back to your surgeon," which he did. And the surgeon had it analyzed, and it was cancerous tumor. Well, he went and had an evaluation, and the doctor put a scope up into his bladder, looked up where the cancer was before, and told him that he's confused by what he sees. He couldn't see any cancer where the cancer was before, so he ordered a CT of this man's abdomen to evaluate the bladder. When the radiologist reported the results, he also couldn't see the cancer. So essentially, we came to the conclusion, as his other physicians did, that the cancer was released by the body because of the therapy he was using, and the patient has continued to improve. I have a case recently that I saw that the lady who's from Africa, who comes to this clinic, she's Ethiopian, and she came with very advanced colon cancer, and after a period of time, her numbers continue to improve, she has continued to improve, and when they went back to recently do a CT evaluation of her abdomen, it showed not just that the liver cancer was no longer there, but the peritoneal carcinomatosis that had come from the colon cancer had stabilized, and the masses that were continuing to grow were actually stable. I do understand that the government and its agencies are there to intentionally or try and protect the general public, but I have found, and I know that the research bears this out, that this is a natural substance. It is something that is non-toxic, the patients can do on their own, and it really does work. So I think that the future of GcMAF is going to be good, but I think it's going to be a lot better in the future when integrative doctors like myself take the many, many years of our experience and add it to the armamentarium of what we use. And I think the response is going to be phenomenal.